Good evening. I'm Stuart Pittman, and this is Tuesday Night with County Executive Pittman. And our topic tonight is COVID Frontline, the folks who are working on the front lines of the battle against this pandemic. And those people are not just in the hospital, but folks in the health department as well. And I'm going to go around the group and we're going to talk to each of you. We have a representative from our environmental health division, which does enforcement, compliance with state and county restrictions, business compliance and inspections. So we're going to hear from Don Kurdian on that. Then we're going to move to Jacqueline Phelps, who does testing for the health department. And then we're going to move on to Tracy Dill, who does contact tracing for the health department. And then on to Justin Bowser, who works at Anne Arundel Medical Center in the nursing division in the COVID unit. So we're going to hear about the work that's being done from the people who are actually doing the work. But I just want to start out by saying that clearly we're in a time in the pandemic when people are tired of restrictions. They're tired of this pandemic going on as long as it has, and our numbers are increasing really rapidly. The county's positivity rate and its case rate. Our case rate is at 42 now. And remember, it was just not that long ago when we hit 10 on our way to 42. And that was what kept us from reopening schools on the schedule that we had planned. We had gotten down to a case rate of about 5 during the summer. And while the hospitalization rate and certainly the death rate have come down because our medical professionals know a lot more than they did, it's still a deadly virus, and we still have hospitalization numbers. That's the part that concerns all of us the most, that are climbing at a time unlike the spring when our hospitals were at normal activity levels. In the spring, the governor cleared out the hospitals by requiring that certain surgeries not take place. So it's a different situation. It's a very difficult moment. I and other county leaders are certainly, and the governor are looking at whether we need additional restrictions to push these numbers down. But let's focus now on the hard work that's being done in the health department and in the healthcare field on the front line. So let me start with you, Don. Don Kurdian is, some of us call him Saint Kurdian because he's the guy that does the work that nobody appreciates, that going to the businesses and responding to complaints about businesses that are not in compliance with COVID restrictions, and then making sure that the inspections are getting done, the education is getting done. And I have to say, Don, that I get CC'd on some of the emails that come to you, and I wouldn't want your job. But tell us what it is that you do and how it's going.
So the environmental health staff and myself are in charge of the enforcement of all the executive orders that Governor Hogan, as well as yourself, have executed. Back in April of this year, the governor had granted the authority to manage safe buildings or safe businesses to the health officer. So the health officer assigned that to the Environmental Health Bureau. We are already a regulatory division, so we're used to doing enforcement of regulations. So my staff were able to get up to speed very quickly. We receive complaints. All of our inspections are done based on complaints only. We receive complaints from the public when they are out shopping or at a business and they feel that businesses are not following the COVID-19 executive orders. And those are related to capacities of those types of businesses, social distancing, as well as face mask wearing. And not only is it just the customers, it's also employees. If employees are working at a business and they don't feel that they are safe while they're working there, we go out and investigate those complaints as well. Since April, my staff have investigated over 2,000 complaints. like I said, this program is complaint based, and it's also an educational type program. Our intent is not to make it harder on businesses. We all know what challenges these businesses have had to put up with this year by not being able to operate at full capacity. At some time in the pandemic, some were closed and then they had to open with restrictions and limitations. That makes it very challenging and difficult for the owners to run the businesses. With that in mind, when we go out to do an inspection, if we find violations, we educate the business on how they can run the business better, what things they can put in place to have a better system in place for either markings on the floor, plexiglass at the cashiers, just anything to keep the employees and the public safe. We've only issued 275 orders of immediate compliance. And our orders of immediate compliance means we've received a complaint, we've gone out to investigate the complaint, and when we arrive at the business, they are in violation. We mark on the order what the violations are. We provide educational materials of what the violations were and what they can do to improve. And we come back after, it's just a warning, it's not a closure. We come back in 3 days, within 3 days, to re-inspect. If everything has been corrected, that complaint is closed and we no longer visit that site unless we get another complaint. If the violations still exist, then we order that business to close until they can put a plan in place to operate the business safely. Usually, a closure lasts 2 or 3 days. The business puts a plan together, sends it to us. One of my staff will then go out and meet with the business. If everything is in order, we get them back open within a few days and they're back operating safely to finish out through the pandemic. As you can imagine, enforcement is not always received in a positive light. We've had some situations where my employees have been approached by patrons of businesses or business owners that were not happy. So it becomes a little confrontational. We have partnered with the Arundel County Liquor Board to do some of the late night inspections at the food facilities that also have a liquor license. So that helps with my inspectors working in the evening. We also work very closely with the Anne Arundel County Police, where we feel that we need extra support, and they have been more than willing to go out and work with us. And just recently, my staff has trained a group in the city of Annapolis, in their code enforcement group, to do the inspections in the city of Annapolis, because there's a lot of food and alcohol establishments in the city of Annapolis. We want to make sure that everybody that's going to those facilities are also safe.
Yeah. And I want to really thank you for having that focus being on education and trying to keep businesses open and open safely rather than trying to shut them down. I think, when people get frustrated about these new regulations, these new restrictions, some people get angry and they think that somehow the government likes doing this. And I know you don't like it. I don't like it. I've been in business and I can only imagine what it would be like to have, there's enough regulation already to have these additional restrictions. And then, as you know more than I do, a lot of the complaints are not really originated by what the business does, but how the customers are behaving. So in bars and restaurants in particular, is that true?
Yeah, it is. I mean, we get a lot of complaints where the customers and the patrons themselves are not following the rules. And it's very difficult for the businesses to run their business as well as supervise all the people that are in their facilities. So some of the customers take their face mask off. They're not supposed to be within 6 feet of each other, and then they start to congregate and gather. And that then other people feel unsafe that they're in there trying to either shop or have a dinner or a drink, and then they feel unsafe based on the actions of some of the other customers and patrons.
Right. Right. I know some of the ones that have been most highly publicized have originated with people who've complained, and they've had legitimate complaints, and you have to respond just like a police officer has to respond, you know, if somebody breaks the law, whether they agree with it or not. So yeah, thank you for all of that. And we do have questions that I want to encourage people who are watching on Facebook Live to type in questions into the chat, into the comments, and then they'll get forwarded to me and we can ask them. But I'm sure that we'll get some on this whole enforcement thing. But one that I want to ask, in case nobody else does, is you know, the governor, when he makes his press conferences, he almost always encourages the counties and local jurisdictions to do more enforcement. That enforcement of existing regulations prevents us from having to add more restrictions, and recently added the Maryland State Police to the arsenal of folks to help with inspections. And I want to note that you did the inspections at businesses, but if it's a social gathering type of violation or a mask wearing out on the street situation, that's not the health department, right? That actually goes to the police department, correct?
Correct. That is the police department. The health department only is in, you know, enforcing of the businesses and having them operate safely. And the police are, you know, all the social gatherings or someone doing something out on the street or a large group together on a field or at a backyard. Those types of things are for the police. And yeah, the governor has been very, very vocal of, he wants the local jurisdictions to stay on top of enforcement. That's why the state police have been added to it. And he was the one that suggested that counties partner with their liquor boards inspectors, because that gives you another resource of a group of inspectors that are already familiar with the facilities that have liquor licenses. So partner with them, and we have partnered with them, and that's been a great collaboration.
Right. So our liquor board inspectors have been helping. We've also redeployed existing staff who from other departments of county government who knew nothing about this, that you had to train and put out there, who've worked in public works and other agencies. And that's been, hopefully they've been good. Has that been helpful?
Yeah, it has been. Yeah. And, you know, my staff are really good. We have a good system set up in training. We use Google a lot because we're not in the office like normal. So we're working from off site and then doing a lot of field work. We don't want all of our staff to be in the office all at one time. You know, your program to hire some inspectors through the workforce development program has worked very well. We have very good inspectors. We really hit the jackpot with some that really have taken to this and enjoy doing some of the evening inspections, which have been very helpful.
Great, good. Okay, well, our message out there to everybody is that be kind to your inspectors from the health department. They're just trying to do their job and to protect the public and to keep the businesses open. So, and to prevent further complaints from coming in. So it's difficult to have patience in a time like this, but there's light at the end of the tunnel. So hopefully this will all be over in a matter of months, not years. So let's thank you, Don, for your work, and we may ask you to answer some additional questions as we go on. But let's jump over to Jacqueline Phelps, who works in the health department also, and does supervising and actually out on the front lines of testing at our test sites, and has been part of that process from the beginning, because you were one of the famous school health staff, school nurses, redeployed when the schools were closed to do other work in the battle against COVID. So Jacqueline, tell us what you do and how it's going.
Hi, thanks for having me. So my name is Jacqueline. I'm currently the nursing supervisor of community-based testing and our pop-up clinics within the health department and our COVID-19 testing initiative. Like you said, I started out as a school nurse, and then when schools closed in March, I came over and started helping with our COVID testing with the disease prevention and management part of the health department. So I started out at our Glen Burnie site at our vehicle admissions inspection site, and I moved to Annapolis, and then this job became an opportunity, and now I'm here doing this. So essentially what we do is my staff consists of other nurses, certified nursing assistants, and certified medical assistants. We staff all of the testing sites around the county, our main drive-through sites in Annapolis and Glen Burnie, and then our pop-up sites at our O'Malley Senior Center, and then around the county that we scheduled weekly. So they're with you, my staff, from the very beginning when you check in at arrival, to making your lab slip, checking you in on our tablets, and then actually collecting the specimen and then helping us send it out to the labs. And then after that, it goes to the lab for processing, and it returns back to our results team that then come into contact with you about whether you're positive or negative. I have some interesting statistics about testing. On average, we can test about 1,000 to 100 people a day at all of our operating sites. We have on average about 5 to 6 testing sites open Monday through Friday, and then we always have our 2 testing sites open on Saturdays, and that's at our Annapolis site, 1 Harry S. Truman, and then our Glen Burnie site, which is at Bay Meadow Business Park. We test about 6,600 people a week over all of our sites, and that is about 3 to 4% of the county's population that we're testing weekly. In the month of November, we tested over 30,000 people at all of our sites, and as of last week, we've hit 100,000 county residents tested since the pandemic began. So we're constantly trying to increase accessibility to testing, our hours and our locations. We've really tried to put more evening hours out there for people that are working during the daytime, and then we have the Saturday hours. So we always have our main drive-through Annapolis site, like I said, off of Harry S. Truman. That's open Monday through Friday, 9 to 12, and then 1:30 to 3, and then Saturdays 9 to 11. That's by appointment only, and it is a drive-through site, so you do stay in your car the entire time. You don't have to get out into the elements or anything. And it's similar to our Glen Burnie Bay Meadow site at 6701 Bay Meadow Drive in Glen Burnie. Those hours are slightly different, 8 to 11, Monday through Friday, and then 1 to 3 p.m. on Mondays, Wednesdays, Thursdays, and Fridays. Tuesday evenings, we open from 4 to 6. So testing actually just concluded about 20 minutes there, which is really nice for, like I said, the people that are working during the daytime. And then Saturday hours, 9 to 11 as well. So again, this site is by appointment only, and it is still a drive-through site, so you stay in your car. And then we also have a semi-permanent site at O'Malley Senior Center. That's Monday through Friday, 9:30 to 11:30, and then Wednesdays, 4 to 6.
So Jack, let me jump in before you continue. And could you tell us where you go on the internet to find out what you just said?
Yes.
And then maybe we could have somebody type that into the comments in Facebook so people can find it.
Sure. So to find our testing schedule, all the locations, the times, and then the location of the pop-up sites that change weekly, you can go to our website, which is aahealth.org. If you go right onto that website, the very top banner says COVID testing. Click that. It's going to bring you down to a list of all of our testing sites, and at the bottom is even a calendar that you can print out with all the sites and times. Right on that page gives the link for appointments if it's a site that needs appointments. We do have a few that don't require appointments, like our pop-up testing, and then a partnership we have with Arundel Medical Center and Baltimore Washington Medical Center. They run 2 testing sites, so you don't need appointments either. But our other ones you do, so you click that link, it'll take you to a page where you put in your demographics, and then you choose a site in the county, and some are even across the state, so in different counties, and you choose a date and a time. You can also get more information on our Facebook and our Twitter pages for that.
Okay, and I have a question from the audience. What is pop-up testing?
Great question. So that's the main part of my job, is scheduling pop-up testing. So what that is testing clinics that I set up around the county that are not a permanent site. So I try to get in contact with local businesses, local churches, and religious organizations are helpful, and I partner with fire departments and their sites. So we go out there, we set up a mini testing site that runs weekdays, Monday through Friday, 9:30 to 11:30. And we set up all the equipment, all the testing supplies, and then the public can come to us for testing. So we have the availability to do 200 tests at each of these sites. And I do try to spread it out around the county to, South County, other places that don't have a whole ton of testing on a regular basis. So if you're interested in hosting a testing site, there is an interest page and link on our website, aahealth.org, where you can go in. It says interest in hosting a site, put in your information, and I'll try to be in contact with you as soon as possible.
And I would just note that on the pop-up testing that from the beginning, the health department set up the health equity task force and had a group of county residents that are particularly from minority and underserved communities where underserved by by doctors and by health clinics, where people don't have cars to be able to get to the health department. And one of the first things they did was to create this system, this amazing system of pop-up testing, so people can just walk right up and get tested. So thank you for that. There's also, I remember when Dr. Kalyana told us that we have to get to 2%. We have to get to the point where we're testing 2% of the county population every week to really get a handle on the spread of the virus and get. And now you're saying that you're doing 3 to 4%. And when he said 2%, I don't think you were even at 1% yet. And we all looked at him like he was nuts. How are you going to do that? And he said, we got smart people. We're putting together a plan. We're going to figure out how to do that. And wow, it's been a huge amount of work. So yeah, thank you for what you're doing. I know that there are other places where it's much harder to get tested than it is here. And my sister-in-law who lives in Oregon had COVID symptoms, and she wasn't sure they were COVID symptoms at first. And she said, well, they won't test me unless I have COVID symptoms. And we thought, you have to have symptoms to get tested? That's like prehistory. That was at the beginning of the pandemic in Maryland. So, it's great that people can get tested as much as they can. And I know that there's plans to do rapid testing as well. I don't know if we want to get into that whole topic, but that's probably the next round. Can you at least, though, you probably are pretty good at this, tell us the difference between the rapid tests and when those get used versus the tests that you do now?
So the test we currently use is a PCR. So it's a swab that we take and then we send to the lab that processes it. It's pretty accurate. I believe the last thing I read was about 96 to 98% accuracy. So the rapid tests are a little different. We actually swab the person and we use a machine we have on site to then test the specimen and see if you're positive or negative. So we can get a result within 15 minutes for that. We have about to an hour after collecting the specimen to see the result. The accuracy is a little bit decreased from that, but sometimes if you need it, for work or school or something immediately, you have that immediate result, which is nice. Because right now with our PCRs, I think that we're seeing about 48 hours to 72 hours for results, which is actually still very good on a national scale. So it's just a little bit different. We will eventually start offering the rapid testing. That's definitely a plan in the works for the future.
Okay. Yeah, I know that the rapid tests are hard to come by. They're much more, they're expensive. And I know there's a plan underway to do more of that. But I also want to note that the turnaround time was a couple days, and then it got really bad recently, right? With the Thanksgiving surge of people getting tested. And it got up to even a week, and now you've switched labs to fix that, right?
Yes, we switched to another lab that is really helping us move these test results very quickly. Yeah, so I've heard of some people that have gotten it back within 48 hours. Great,
good. That's good. And when's a good time to go for the drive-through at the health department or in Glen Burnie when the lines are the least or the shortest?
So our 2 drive-throughs at the Annapolis site in Glen Burnie are by appointment only. So you do need to make that in advance. You can usually make an appointment within 24 hours of a time. So we just say, sometimes if you go on, you'll be waitlisted initially, but then they'll email and text you when slots open. So log right back in and sign up for a spot. At our pop-up sites, we run them usually from 9:30 to 11:30. We have a little bit of wiggle room with some other sites that we do for pop-ups, But I would suggest for those sites to walk up without an appointment, to arrive early by 9 o'clock, because we do only have 200 tests at those sites available. But if you get in line, early enough, we'll definitely be able to test you.
Okay. Well, it sounds like it was a good move to go to by appointment only at the other sites, because I know the lines were getting pretty long there for a while.
They were, yes.
Yeah. So, okay. So you get your test, you get your result back, and it's positive, which means you're going to get a phone call, right? Most likely.
I'm going to be calling you.
So we have Tracy Dill here, who does contact tracing for the health department. And I just have to say before you start that in the very, very beginning, Dr. Kalyana Raman said, we've got to contact trace every single case. We've got to be able to call every positive case and help, find out who they've been in contact with, try to find out as much as we can about where they might have gotten it, and then contact people who've been exposed, and connect with those people so that if they're having trouble figuring out how to not go to work, how to isolate, and that we can help them. And so I know that we were the only ones in the state of Maryland. I think we were one of a few jurisdictions in the whole country that really got that started right away. And it was thanks largely to the availability of school nurses who were redeployed to contact tracing that we had enough staff to do it. And then one of the things that made me most proud about it is that it's not just, the state's contracted with a vendor, and most counties just send their contact tracing to that vendor, which is NORC, which is based in Chicago. They probably have operations everywhere, but it's outsiders making these phone calls to the people who've tested positive. But we have local folks who are connecting with people and then helping to provide services. So I call it contact tracing and case management as opposed to just contact tracing. So tell us how that all works.
Yeah, I think that's a good point. So the purpose of contact tracing is really multifaceted. One of our jobs is to obtain demographic information on everyone so we can determine exactly who is being affected by the virus. And that's kind of our first job, I say. Our second job is the one that most people associate with contact tracing, and that's to collect all the information we can on who and where a case might have been exposed, as well as who and where they may have exposed others, okay? This is where we spend a good amount of our time collecting that data and then following up by calling those exposures. A third part of our job, which I would argue is equally important, is that education piece. How can we make your life easier right now? What information can we provide? And that might include things like what will your isolation or quarantine look like? How long will it be? What's the best way to do it effectively? How can you protect your family during this time? And then what emergency symptoms should you be looking for? And then when maybe would you seek medical care? And I'd venture to say that every single contact tracer has experienced at least one call where either we've called 911 or we've directed a person to immediately get off the phone and seek medical assistance. So that also is an important part of what we do. Some people are just waiting for that direction. They're not really sure what they should be doing. So we're not doctors, but we can help lead them down the path of, checking in with their doctor or going to the ER, just providing them with that knowledge of what the next step should be. In addition, we provide information on what resources a person might need during the pandemic, perhaps due to the loss of a job or maybe some mental health issues they feel like they're experiencing. Maybe they need resources on caring for their children because they're sick. So we can give them some resources that we've been provided that they can reach out to, even outside of the health department, just places that they can call and get that information. We are providing information now on the new COVID alert system in Maryland, how you can activate that on your phone and how it helps to stop the spread. More and more people are aware of that, but some people just may need a little help setting it up on their phone. So hopefully as that becomes more popular, it's going to be more helpful in Maryland as more people are using it. Our fourth role is not one you would really find in the manual, I would say, but I feel that it's maybe the most important, and that's just to provide a listening ear. These are really stressful times, and we have a wonderful group of 80 plus contact tracers. We put in long hours just so everybody's aware. We're pretty much mostly full time, but the contact tracing department is open from 8:30 in the morning till 9 o'clock at night during the week, and then 9 to 6 on the weekends, so we can reach as many people as we can. And we take the time not only to educate and explain, but to listen, empathize, and show compassion to people. And many people that we talk to, they don't have anyone else to reach out to. They don't have a resource for a lot of the questions they have or the concerns they have. So we take it on ourselves to listen, to help them understand, where they can get resources, and just to listen to, I've had people cry on the phone to me before. They're just so sad and upset. So, at the health department, we really try to be there for them, whether it's testing, contact tracing, whatever department we're in, and try to help them out through this. When we're finished, we always provide a callback number, a phone number that they can reach back out to us. Each contact tracer has a separate extension. If they have a question in their quarantine period, reach back out to us. We'll try to help you and answer any questions you might have. I've been doing this since April, pretty much since the beginning, when we were using paper and pencil. And you're right, we all came over from school health, and it's changed a lot. We now have this wonderful statewide database that we use, and so that's all changed. But we've also seen a lot of changes that we were hoping we wouldn't in the number of cases that we process each day. When I first started, we were maybe doing probably less than 100 cases a day, and now we're almost up to 400. And that's not a good change, but we're keeping up with it. We're working really hard to get through all those. We, in addition to those calls every day of, now close to 400 new cases, each of those cases has sometimes 3, 4, 5 or more contacts, people that they've, and either in their house or out at their job, or, someone they went to a family gathering. Some cases can have up to 10 contacts. So each day we're easily making 1,000 calls of, whether it's a case or a contact, trying to explain isolation, explain quarantine, and all that. So it's a lot of calls right now that we're making. And I just want to talk a little bit at the end about some of the challenges that we've been seeing lately in contact tracing. I think this has always been a problem, but lately I think we've noticed more just the lack of people answering the phone, even when we leave a message. So it's not necessarily that they don't know who's calling, because we always do leave multiple messages, but they just aren't calling us back. So there's just that unwillingness to participate. And I think we're also seeing a trend in people not isolating in their house, which is something that maybe you haven't heard about before, but we're seeing a lot of households become infectious because people are being more lax once they get the virus. And instead of isolating in their own little area, they're willing to kind of let that go through their family, which is an interesting thing. But that's a lot of times now we're seeing one household member kind of get it right after the other. So that's a little bit of a challenge we've been facing. I would say the biggest challenge we're seeing to date, and very much recently, is people leaving the house symptomatic. We're seeing a lot of people that are not paying attention to their symptoms and staying home and going to get tested. So they have a symptom, maybe a sore throat or maybe a congestion, almost appears like a cold, and they hold tight a couple days, keep working, decide they'll go get tested, go back to work some more, wait for the test result, and then they get the test result and they're positive. So now in the past 5 days, they've been out and about with these symptoms instead of staying home. So from a contact tracing perspective, we're seeing that a lot. And I guess my advice to everybody would be, if you have any kind of symptoms right now and you think it's a cold or you think it's asthma or I'm sorry, allergies, assume it's COVID. Always assume it's COVID and stay home. I would love to get that message out there because we see that a lot. So hopefully that explains what we're doing in contact tracing, what we're seeing in the community, and how we're helping Anne Arundel County residents affected by the virus.
Wow. I'm kind of blown away thinking about the fact that there are 80 of you and that you're open pretty much all the time and making that many calls, and then that those calls are not, it shouldn't even be called contact tracing. I mean, you're counselors for people who have infections, and so you really know what's going on out there, like the rest of us don't. And it's disappointing to hear that people are being more lax. I mean, I think there are still people who think, oh, well, this is no more deadly than the flu, but well, we've lost over 300 county residents in less than a year. And last year, how many people did we lose from the flu? Like 17. So yeah. There's no comparison. And while it's true that most people don't end up in the hospital, enough do that it's putting major stress on our healthcare system. And we're at a point where during the summer, maybe it wasn't, quite such a threat, but with the numbers that we're seeing now, simple math shows that it is. So thank you so much for what you're doing. And I hope that people think about other than themselves when they're deciding whether to go to a gathering, wear a mask and social distance and prevent the spread of this thing. So, well, that was fascinating. Okay, so for those people who do get very sick, those people who even you have had to call 911 for because they just don't realize how dangerous it is in the moment, they end up in Anne Arundel County, either Anne Arundel Medical Center or Baltimore Washington Medical Center. And we have with us here Justin Bowser from Anne Arundel Medical Center, Luminous Health now, the parent company. And you're on the front lines. You've seen it from the beginning. Tell us what it's like and what you're seeing, Justin.
Sure. So thank you for having me on first off. Throughout this entire pandemic, really, when we started in March, we have seen just a massive amount of patients coming in with a variety of illnesses. And we see more than just COVID patients. Just want the public to understand that, the patients with heart failure still come to the hospital, the joint replacement patients still come to the hospital, those with, urinary tract infections still come, but certainly the large portion of patients we're seeing now are those who are admitted with COVID. And throughout the whole pandemic, this virus has been very unpredictable, where we see it affect people differently. We see it affect patients who have, a lot of comorbidities like kidney problems or, high blood pressure issues. But we also see the young population affected who have nothing medically wrong with them, and they come in with significant respiratory distress, and then they're seeking urgent care. But I do want the public to know that, the hospital is always here to care for patients. We're always equipped in order to do so. We have a very skilled team of professionals all over the organization that are working tirelessly on ensuring that we're monitoring our capacity for beds, our supplies, our staffing. So we're always one step ahead of kind of what we're seeing in terms of the virus. We're actively planning for potential increases in surges. We certainly hope we don't see what we're forecasting, but nonetheless, we're always equipped and we're preparing to adequately take care of anyone who comes to the hospital, regardless of what they're coming in for. During this pandemic, we've certainly learned a great deal about the virus in terms of how it attacks the body, some of the symptoms that we see with patients, trajectory of patients in terms of the severity of their illness. We've had a lot of different clinical trials that we've done through the pandemic, and we really have it nailed down to what are we finding that which treatments are most effective. So we've seen dramatic improvements of the severity of illness of patients, the duration of the hospital stay for patients, reduction in our ICU volumes and the number of patients on ventilators. We have a very top of the line research team at certainly at Luminous Health that are always proactive and always innovative in determining, the best course of action for treatment for patients. Some of the more common treatments that a lot of the patients are getting are patients are being put on steroids to help reduce inflammation of their lung tissues, to help to open their airways with assisting with breathing. Many patients are put on blood thinners, as we know that with COVID, patients are at a much higher risk of developing blood clots. And certainly these can lead to pulmonary embolism, so a clot in your lungs that can affect your ability to breathe. It can cause patients to have heart attacks, strokes. So the majority of these patients are put on blood thinners to prevent these symptoms from occurring. And we're also giving a intravenous medication called remdesivir. Many of you have probably heard of it. That was approved through the FDA, I believe it was early November. So this is an intravenous infusion that is given to patients who are diagnosed with COVID. And what it does is helps to stop the replication of the virus. So we are looking at this medication to decrease the severity of the virus, but also decrease the duration. So many of the patients who are hospitalized and are severe enough to be hospitalized are given this infusion throughout their hospital stay. My message. Sorry, go ahead.
Oh, well, not to be remdesivir, not to be confused with Regeneron. I know some people confuse those two, which is the wonder drug that the president was given. Which is that available in the hospital?
That's currently not a medication that we're giving. There are treatments all over the country that are being utilized in different healthcare systems. What I just mentioned now, these are the standard treatments that we're providing. It's not to say that we won't change treatment in the future, but that's just not currently what we're doing right now.
Right.
As we've heard speakers before, the best way that we can protect ourselves is to certainly make sure that we're wearing our masks, we're washing our hands, and we're washing our distancing in terms of, being with family, being with friends. It's difficult. I think we can all agree that it's hard to change your events, to change your social gatherings. But this is a virus that is ruthless, it's relentless, and it can affect anyone. Even if you get symptoms mildly, you're still a carrier and you can affect somebody else and it could just decimate them. That we really have to be vigilant and stay vigilant at all times, just to protect ourselves, but also we need to ensure that we're protecting our healthcare system. Because as I mentioned, we're not just seeing COVID patients, we're seeing patients with other diagnoses. So we have to stand firm in the public to ensure that we're taking appropriate measures.
And that's been one of my biggest concerns is my mother. I won't give her age, but and I shouldn't even talk about her health much, but I think about what if she has to go to the hospital, heart conditions, whatever. And I want to make sure that things are running smoothly, beds are available. And so we have to think about the surge capacity that was talked about a lot in the beginning of the pandemic. It was a little bit of a different situation, right? Because those the census in the hospital was forced down, which cost the hospitals a whole lot of money, and it also cost us as a community a lot of health conditions. Our fire department was saying that people weren't going to the hospital when they should be. And we don't want to get back in that place, but it means that our surge capacity is harder to create. So that's where we stand right now, is that in order to accept more patients, one has to redeploy staff. And we can't get them from the locations that don't have coronavirus, like in the spring, where it was mostly in the Northeast and the West Coast. Now it's all across the country, so it's much harder to bring in temporary staff. Is that true? Are you?
It's made it a little more challenging, but we're still extremely successful in bringing on agency staff from all over the areas, certainly, around the Maryland, Virginia, Pennsylvania borders. So we've been very fortunate to have the ability to recruit staff and have them arrive at the hospital even within just a few short weeks. So I think we're doing a wonderful job with ensuring that we always have the adequate staff in order to care for the patients. The point you mentioned earlier about in the very beginning of the pandemic in the late spring, early summer, right, we shut down a lot of, pretty much most of the elective surgeries. We saw big decreases in the number of visits coming to the hospital. And I think that has to do a lot with the fact that patients were putting off the severity of their symptoms to the point where it was just becoming uncontrollable. And then when they came to the hospital, they were much sicker than what they normally would have been had they come in sooner. And certainly that was part due to the fear of the pandemic. So again, I just want to stress to the public that, our hospitals always remain open. We always remain available to care for you, no matter what is going on, if it's COVID, if it's renal issue, diabetes, whatever it is, we're always here, we're always open, and we can provide that care for you. So please ensure that you're following up with your primary care physicians if you have one. Ensure that you are seeking medical attention early, just to prevent any more serious issues from occurring.
And we're really lucky we have such great hospitals in Anne Arundel County. And I've spent more time at Anne Arundel than BWMC. Kids born there, and I think most of us have real love for the hospitals and the people who work in them, who save our lives. So thank you for what you're doing. Let's see. I got a few questions here. One, Megan asks, how can we support our frontline workers? Anybody have a thought about that?
I mean, certainly, as I mentioned, taking the appropriate steps to protect yourselves, to reduce transmission of the virus, in hopes of lessening the total volumes that we're seeing. That's always a big help. Early in the pandemic, the frontline workers always appreciated the donations of food and supplies from the various businesses and organizations. That's always well received because nurses and doctors and techs, everybody loves food. We love sweet treats. So that's always something that's a plus. But the biggest thing is, again, ensuring that we're taking the necessary steps for prevention. So wearing your mask, washing your hands, washing your distance. That's the number one thing that the public can do to help the frontline workers.
Push down the numbers. Yeah. Yep. Okay. And I did hear some stories earlier about, at least at the testing centers, that people are pretty friendly for the most part, and have even brought some treats, I understand, right?
Yes, they definitely have. We had a Chick-fil-A today, which was very nice. But I agree with what Justin said, just the whole, maintaining precautions and trying your best to prevent the spread. And then just being respectful to staff. We see a lot of really appreciative people that come through, but just remember that these staff are just there working too.
And those contact tracers are holed up in these. I've been there, and you guys it's not the greatest working conditions. You have your little cubbies because there's so many of you.
We'll take Chick-fil-A too.
Yeah, we might just have to do that. Yeah, and then when an inspector comes from the health department, yes, just be kind, right, Don?
Yes, be kind. And again, if we wouldn't be there if somebody didn't see something that wasn't safe. So if we all follow the rules, less and less complaints of businesses would come in.
Right. And here's one that from Suzanne, and her question, I almost hesitate to ask it because it's a difficult one, because I know that we've dealt with it some, is, are there volunteer opportunities available to help? And I know that from the beginning of this pandemic, I mean, we have such wonderful people in this county wanting to volunteer and help. And I know that that in food distribution, there are certainly opportunities through a lot of the organizations that are doing food distribution. And you can contact them. But and I know that our the 7265 number, I believe it is. Jenny can correct me in the chat if I'm in the Facebook if I'm wrong. But for the Office of Emergency Management, we were getting a lot of calls in the beginning where people would just want to volunteer, and so they were connecting them with volunteers. But in the frontline healthcare scene, what you all do, are there volunteer opportunities? I mean, I'm guessing that folks have to be trained.
Sorry.
Oh no, go ahead, Justin.
So on my end, we don't necessarily at this time have many volunteer opportunities, but like I said before with the pop-up testing, if you are connected with an organization, a business, a religious organization, place, if you'd like to volunteer in a spot, we are always open for that for testing. And then if you're connected to that, then we also do appreciate if some staff from those businesses and organizations are around to help with traffic flow at our pop-up clinics.
Okay. Did you have something, Justin, on that?
I was going to say, with certainly the hospitals have visitor restrictions for, the safety of the public, safety of the staff and the patients. But one thing that folks can do to volunteer is those who have been infected with the coronavirus and recovered from it, you are able to donate plasma. And that is one of the other treatments that hospitals are using is what we call convalescent plasma. This is what somebody who has the virus recovers from it, donates their plasma. They've built up the antibodies to fight the virus off. And we use those same plasma units to treat other patients who are actively infected in the hospital setting. So those who have had coronavirus and recovered from it, please reach out to the different blood donor centers. You can reach out to the hospital here. Consider donating plasma because your unit of blood can certainly save a life of someone else.
That's a really good point. Yep. And last question is from Gethin. And you've answered this already, but I'm going to let you stress it if you like. Are our hospitals still seeing people impacted by other illnesses? And that's a resounding absolutely and always will, right?
Yeah, we don't stop serving the general public for whatever they come in. It can be anything from a heart attack or a stroke or complications from cancer, COVID, skin infections. We don't stop treatment for anything. So we're always open and we remain open to help the public.
And I know that early in the pandemic, people were worried about getting infected in the hospitals. And I understand that your protocols now at this point are pretty amazing to keep that from happening.
Yeah, we have extraordinary protocols in terms of how we're cleaning our rooms, the PPE and supplies for the patients and the staff and all those coming in and out, the hand sanitizer stations, even to setting up the lunch rooms for staff and break rooms and changing everything to virtual meetings for the organization. We've really developed exceptional safety measures to make sure that not only the caregivers are safe, the patients are safe, the general public is safe as well for those who are here.
And then the last question is when will vaccines be available and how can we get them? And I know we don't have the people from the health department who are working on that, but I can tell you that I've been getting briefed on that. In fact, just today I was hearing as well that our health department has a team working on exactly that. There lots of unanswered questions about timing, when the first batch will come, and that first batch we know will actually go, some of it will go directly to the hospitals to be able to vaccinate the healthcare workers that are in the hospitals. And then some of it will go to our nursing homes to vaccinate the people who work there and live there. And then the next batch, which we have no idea what the timing is going to be, that will be going to first responders, some of it, and the state will be deciding, state and the feds, but the state has a plan for the order of who gets vaccinated. I just know that our health department is working on mass vaccination plans in negotiations right now with the the Naval Academy to be able to use the stadium parking lot for a very large site for that, and gearing up. So we've funded that process through our CARES Act money, and the work is being done in advance so that we'll be ready to move forward. The freezers are either on order or we have them. All of that work is underway, thanks to our incredible team at Anne Arundel County Department of Health. So thank you, everybody. Thank you, all of you, for everything that you're doing. Wish I could give you a big hug. Wish I could give you big raises too, but I know you're getting a lot of satisfaction out of doing this work, and I just want you to know that thousands and thousands of people really appreciate it. So
Thank you.
thank you, and
Thank
have
you.
a great evening.
Thank you.